Hi, this video will teach you how to administer your insulin via a Novopen.
Insulin is a drug often used by diabetics. Follow these instructions to properly administer your insulin via a Novopen. First, wash and dry your hands thoroughly. Proceed to pull off the cap of the pen. Then twist the pen apart. If the piston rod is sticking out, push the piston rod back in. Check the cartridge to make sure that it contains the right type of insulin for you and that the insulin in the cartridge is not expired. Insert the cartridge into the cartridge holder of the pen. The color-coded cap should go in first. Then twist the pen back together until you hear or feel a click. If you are using a cloudy suspension insulin, roll the pen between your palms 10 times or until the solution in the pen is consistently cloudy throughout. Do not shake. Use an alcohol swab to clean the rubber membrane of the cartridge. Then tear off the paper tab of a new needle and screw the needle straight and tightly onto the Novopen. Remove the big outer needle cap and keep it for later. Also remove the inner needle cap and throw it away. Pull out the dose button and turn the dose selector to 4 units. Then hold your Novopen with the needle facing upwards and gently tap the cartridge so that any air bubbles gather at the top. Press the push button all the way in. A drop of insulin should appear at the tip of the needle, and the dose selector will return to 0. If a drop of insulin does not appear at the tip of the needle, pull out the dose button and turn the dose selector to 4 units. Hold your Novopen with the needle facing upwards. Gently tap the cartridge and press the push button. If a drop of insulin still does not appear at the tip of the needle, you may try changing needles before pulling out the dose button, turning the dose selector to 4 units, holding your Novopen with the needle facing upwards, gently tapping the cartridge and pressing the push button. If a drop of insulin still does not appear at the tip of the needle, your Novopen is likely to be faulty. After ensuring that your Novopen is in working condition, use an alcohol swab to clean the injection site on the abdomen and let it dry. The injection site should always be 3 fingers away from the belly button. Pull out the dose button of the Novopen and turn the dose selector to the number of units of medicine that you should be taking. Pinch the fat at the injection site and insert the needle in at a 90-degree angle. Press the push button until the dose selector returns to 0. Keep the push button depressed for at least 6 seconds. After 6 seconds, without releasing the push button, withdraw the needle from the skin. Then release the push button. Remember to alternate injection sites. Other possible injection sites include your upper arms, thighs, and buttocks. To dispose of the needle, carefully place the big outer needle cap onto the needle. After ensuring that the needle is completely covered, completely push on the big outer needle cap and twist off the needle. Dispose of the needle into a puncture-proof container. Your Novopen should always be stored without the needle attached. Otherwise, insulin may leak out, resulting in inaccurate dosing. It is not necessary to remove the cartridge from the Novopen before storing it. Simply place the cap back onto the Novopen. After a cartridge has been used, do not refrigerate. Instead, store it at room temperature in a place away from direct heat and sunlight. You have now successfully administered insulin.
If you have any further questions or are unsure, please consult a healthcare professional.
Thank you for watching this NUH production. Take care.